What is the most common cause of primary hyperparathyroidism? A. Parathyroid hyperplasia. B. Parathyroid carcinoma. C. Parathyroid adenoma. D. None of these. The answer is C. Parathyroid adenoma. Primary hyperparathyroidism is most commonly due to a parathyroid adenoma. 80 to 90% of cases of primary hyperparathyroidism are due to parathyroid adenoma. 10 to 15% cases are due to parathyroid hyperplasia, and parathyroid carcinoma accounts for 1 to 5% of all cases. Secondary hyperparathyroidism is the result of chronically diminished levels of serum calcium. Depressed levels of serum calcium leads to a compensatory increase in the activity of the parathyroid glands. What is the most common cause of secondary hyperparathyroidism? A. Poor nutrition. B. Renal failure. C. Bone cancers. D. Pituitary tumor. The answer is B. Renal failure. Renal failure is by far the most common cause of secondary hyperparathyroidism. If kidneys are unable to convert vitamin D to its active form, serum vitamin D levels will drop. Lower vitamin D levels reduce the absorption of calcium in the intestines and reduce the kidney's ability to resorb calcium from the urine. In addition, if the kidneys are unable to adequately excrete phosphate, calcium phosphate forms, which further lowers free calcium levels in the blood. Poor nutrition is not a common cause of secondary hyperparathyroidism, though low vitamin D levels due to malabsorption can be a contributing factor. Pituitary tumors can be seen with hyperparathyroidism when part of multiple endocrine neoplasia type I, but this is not as common as renal failure. Bone cancers are more often associated with elevated calcium levels, resulting in low or undetectable parathyroid hormone levels. A 50-year-old female client is seen in the clinic for her recent diagnosis of hypothyroidism. Which of the following instructions should be included in the nurse's teaching plan? A. Explain the outcomes expected with removal of the thyroid gland. B. High protein, low carbohydrate diet and replacement hydrocortisone. C. Obtain a hemoglobin A1C test. D. The use of antiglycemic medications. E. High fiber, low calorie diet, and 5 to 6 small meals per day. The answer is E. High fiber, low calorie diet, and 5 to 6 small meals per day. Hypothyroidism usually involves weight gain, so a lower calorie diet with frequent small meals are recommended. High fiber, low calorie diets and stool softeners will help to alleviate these symptoms. Antiglycemics and hemoglobin A1C tests are indicated for diabetics. A middle-aged female client has just underwent a thyroidectomy for treatment of Graves' disease. The nurse caring for this client is aware she may need to monitor the client for what possible complication? A. Bone pain. B. Goiter. C. Oliguria. D. Tetany. E. Tetanus. The answer is D. Tetany. Tetany is a complication due to hypocalcemia which can occur if the parathyroid glands which control calcium balance are accidentally injured during thyroidectomy. Tetany is associated with nerve excitability and sustained muscle contractions, or spasms. Tetanus, bone pain, and oliguria are not associated with complications of a thyroidectomy. Goiter is a manifestation of an overactive thyroid. A 45-year-old female client with Addison's disease has presented to the client for instruction on her medication regimen. The nurse understands that the patient may require lifelong corticosteroid replacement. It will be necessary to educate the client about possible side effects of this type of therapy. Which of the following should a nurse include in her teaching plan about corticosteroid therapy? A. Monitor glucose with finger sticks to check for hypoglycemia. B. Increase sodium intake to prevent hypotension due to edema. C. Increase calcium intake to at least 1,500 mg per day with vitamin D, to help to prevent steroid-induced osteoporosis. D. The medications should be taken on an empty stomach in the morning to avoid nausea if taken with food. E. Increase intake of folic acid and B12 to prevent neurological side effects such as paresthesias of the hands and feet. The answer is C. Increase calcium intake to at least 1,500 mg per day with vitamin D, to help to prevent steroid-induced osteoporosis. Corticosteroids may lead to bone loss, especially after long-term treatment, over 3 months. Calcium and vitamin D supplementation can help prevent these side effects. The client should also be advised to start a low-impact exercise regimen if possible, and if necessary take a bisphosphonate drug.